you're feeling more anxious before your period, you can't sleep, and every little sensory input is grating your nerves. You may have a progesterone issue. We're going to talk about low progesterone. We're also going to talk about progesterone intolerance because progesterone and ADHD, it's interesting. Now, typically, and for the majority of people, ADHD or not, progesterone is going to be metabolized to allopregnanolone. It's going to hit the GABA receptor in the brain. You're going to feel chilled out, calm. You're going to get good sleep. You're going to tolerate people eating with their mouth open, maybe. But because the baseline for ADHD is nervous system dysregulation, cortisol dysregulation, executive dysfunction, we have more stress. And when we have more stress, we may not make ample enough progesterone. And then we are feeling the effects of the nervous system dysregulation that can be part of ADHD. But wait, what if you don't feel good with progesterone? Hi, I'm Dr. Jolene Brighton. I'm board certified in naturopathic endocrinology, which means I'm an integrative hormone doctor. I'm a nutrition scientist and an ADHD girl. And I talk a lot about progesterone, actually. So if you're not familiar with progesterone intolerance, this is actually an article that I wrote just recently on my website. It is something that I observed in neurodivergent women for like my entire career. Sometimes not even knowing they were neurodivergent, but asking the question, why do they not tolerate progesterone? So progesterone, in most people, it's going to make them feel better. But in some people, it's going to actually make them feel worse. They're going to feel anxious. They're going to feel irritable. Maybe they're going to have PMDD symptoms. If you know, you know. So if you're taking estrogen, hormone replacement therapy, you need to have progesterone with you. But if you are finding that you have progesterone intolerance, you don't feel good with oral progesterone, then we've got to go a different route with progesterone. It's going to be either a vaginal suppository or in some countries, injections are available. If you're still cycling, check your cycle. Track it. Do you feel better or worse in the luteal phase? If you feel worse just a few days before your period, odds are it's not enough progesterone. But if you feel worse as soon as ovulation hits or, 5, 10, 12 days, could be progesterone intolerance.